The inotropic medication primarily A. Decreases afterload, B. Increases the force of contraction, C. Decreases preload, D. Decreases heart rate. And the correct answer is B. Increases the force of contraction. Inotropic agents such as milrinone, digoxin, dopamine and dobutamine are used to increase the force of cardiac contractions. A patient reports that he experiences chest pain whenever he performs activities, but it is relieved within a few minutes by resting. This is an example of A. Unstable angina, B. Stable angina, C. Variant angina, D. Prinzmetal angina. And the correct answer is B. Stable angina.
I'm having chest pains. That's a relief.
Stable angina is the most common type of chest pain. It happens when the heart is working harder than usual. Stable angina has a regular pattern. Rest and medicine usually decreases the chest pain. Duke's criteria is related to which disease condition? A. Infective endocarditis, B. Typhoid, C. Hydrocephalus, D. Encephalitis. And the correct answer is A. Infective endocarditis. Duke's criteria are used to confirm or rule out endocarditis. Positive blood culture results for infective endocarditis and evidence of endocardial involvement from echocardiography are the two major Duke's criteria. Which one of these is not a cardiac biomarker? A. Alkaline phosphatase, B. Creatinine kinase, C. Troponin, D. Myoglobin. And the correct answer is A. Alkaline phosphatase. Cardiac biomarkers are substances that are released into the blood when the heart is damaged or stressed. Measurements of these biomarkers are used to help diagnose acute coronary syndrome and cardiac ischemia, conditions associated with insufficient blood flow to the heart. Cardiac biomarkers which can be used to diagnose a heart attack are cardiac troponin, creatinine kinase, CKMB, and myoglobin. Cushing's triad refers to a set of signs that are indicative of A. Increased intra-abdominal pressure, B. Increased intrathoracic pressure, C. Increased intraocular pressure, D. Increased intracranial pressure. And the correct answer is D. Increased intracranial pressure. Cushing's triad refers to a set of signs that are indicative of increased intracranial pressure or increased pressure in the brain. Cushing's triad consists of bradycardia, irregular respirations, and a widened pulse pressure. Which of the following is a non-drug therapy for children with epileptic seizures? A. Ketogenic diet, B. High protein diet, C. Low fat diet, D. High fiber diet. And the correct answer is A. Ketogenic diet. The ketogenic diet is a way of treating patients with unmanaged epilepsy. The diet high in fats and low in carbs works by changing how the brain gets energy to function. Although not well understood, this diet has successfully reduced seizures in many patients. Plasmapheresis can be used to treat which of these autoimmune disorders? A. Myasthenia gravis, B. Guillain-Barré syndrome, C. Chronic inflammatory demyelinating polyneuropathy, D. All of the above. And the correct answer is D. All of the above. Plasmapheresis is a process in which the liquid part of the blood or plasma is separated from the blood cells. Typically, the plasma is replaced with another solution such as saline or albumin, or the plasma is treated and then returned to your body. If you are sick, that is, if you are having any autoimmune disease, your plasma can contain antibodies that attack the immune system. A machine can be used to remove the affected plasma and replace it with good plasma or plasma substitute. This is known as plasma exchange. The process is similar to kidney dialysis. Plasmapheresis can be used to treat a variety of autoimmune disorders including myasthenia gravis, Guillain-Barré syndrome, chronic inflammatory demyelinating polyneuropathy. Parkinson's disease includes all of these symptoms except A. Slowed movement, bradykinesia, B. Muscle stiffness, rigidity, C. Thunderclap headache, D. Tremors. And the correct answer is C. Thunderclap headache. Bradykinesia, rigidity and tremors are all symptoms of Parkinson's disease, whereas thunderclap headache is not a symptom of Parkinson's disease. The perception of pain or discomfort in a limb that is no longer there is called as A. Phantom limb pain, B. Intractable pain, C. Aftermath of pain, D. Referred limb pain. And the correct answer is A. Phantom limb pain. After an amputation, some people experience pain in the part of the limb that's no longer there. This sensation is phantom limb pain. The pain is real. The phantom part refers to the location of the pain, the missing limb or the part of the limb, such as fingers or toes. RBSK full form. A. राष्ट्रीय बाल श्रमिक कार्यक्रम. B. राष्ट्रीय बाल सुरक्षा कार्यक्रम. C. राष्ट्रीय बाल स्वास्थ्य कार्यक्रम. D. राष्ट्रीय बाल श्रमिक कल्याण. And the correct answer is C. राष्ट्रीय बाल स्वास्थ्य कार्यक्रम. Rashtriya Bal Swasthya Karyakram is an important initiative aiming at early identification and early intervention for children from birth to 18 years to cover 4 Ds. That is, defects at birth, deficiencies, diseases, development delays including disability. It aims to improve survival outcomes by decreasing morbidity and improving the quality of life of our children. Shuffling gait is characteristically seen in A. Alzheimer's disease, B. Parkinson's disease, C. Multiple sclerosis, D. Myasthenia gravis. And the correct answer is B. Parkinson's disease. Shuffling gait is a type of walking characterized by dragging one's feet along or without lifting the feet fully from the ground. The most common cause of shuffling gait is Parkinson's disease. Spinal cord is continuous with which part of the brain? A. Medulla oblongata, B. Cerebrum, C. Midbrain, D. Pons. And the correct answer is A. Medulla oblongata. The spinal cord is continuous with the medulla oblongata at the foramen magnum. Which administration method for parenteral iron helps avoid leakage into subcutaneous tissue? A. Z-track method, B. IM injection into the deltoid, C. Subcutaneous injection, D. Intradermal injection. And the correct answer is A. Z-track method. Z-track method is a type of IM injection technique used to prevent leakage of the medication into the subcutaneous tissue. Which test should the nurse check in her assessment of a patient receiving heparin? A. Complete blood count, B. PTT, C. Arterial blood gas levels, D. Hemoglobin level. And the correct answer is B. PTT. PTT stands for partial thromboplastin time. PTT test is the most commonly used test to monitor heparin therapy. PTT is evaluated every 6 hours during the first day of heparin therapy and 6 hours after any dosage change. The nurses are participating in a health fair at the local mall and are giving influenza vaccine to senior citizens. What level of prevention are the nurses practicing? A. Primary prevention, B. Secondary prevention, C. Tertiary prevention, D. Quaternary prevention. And the correct answer is A. Primary prevention. Primary prevention includes intervening before health effects occur through measures such as vaccinations, altering risky behaviors such as poor eating habits, tobacco use, etc., and banning substances known to be associated. Which of the following are the 4 basic techniques of physical examination? A. Interview, inspection, percussion, resonance. B. Inspection, palpation, percussion, auscultation. C. Interview, subjective data, objective data, closure. D. Inspection, palpation, percussion, Glasgow scale. And the correct answer is B. Inspection, palpation, percussion, auscultation. Inspection, looking at the body. Palpation, feeling the body with fingers or hands. Percussion, producing sounds usually by tapping on specific areas of the body. Auscultation, listening to sounds. Which of the following terms denotes patient's inability to void even though the kidneys are producing urine that enters the bladder? A. Urgency, B. Retention, C. Oliguria, D. Dysuria. And the correct answer is B. Retention. Urinary retention is a condition where your bladder doesn't empty all the way or at all when you urinate. Who has decreased mortality by improving sanitation in the battlefields, resulting in a decrease of illness and infection? A. Florence Nightingale, B. Clara Barton, C. Dorothea Dix, D. Lillian Wald. And the correct answer is A. Florence Nightingale. During the Crimean War, more soldiers were dying from infectious diseases like typhoid and cholera than from injuries incurred in battle. Without wasting any time, Nightingale quickly set to work. She procured hundreds of scrub brushes and asked the least infirm patients to scrub the insides of the hospital from floor to ceiling. Nightingale herself spent every waking minute caring for the soldiers. In the evenings, she moved through the dark hallways carrying a lamp while making her rounds, ministering to patient after patient. The soldiers, who were both moved and comforted by her endless supply of compassion, took to calling her the lady with the lamp. Others simply called her the angel of Crimea. Her work reduced the hospital's death rate by 2/3. Transsphenoidal approach is used in the excision of which type of tumors? A. Glial tumor, B. Pituitary tumor, C. Oligodendroglioma, D. Acoustic neuroma. And the correct answer is B. Pituitary tumor. Transsphenoidal surgery is the most common procedure for removing a tumor of the pituitary gland. Rather than opening up the skull in a traditional craniotomy, the neurosurgeon reaches the tumor through the nasal passages and the sphenoid sinus. Cheney-Stokes respiration describes A. Rapid breathing, B. Difficult breathing, C. Moist or stertorous breathing, D. Periods of apnea and hyperventilation. And the correct answer is D. Periods of apnea and hyperventilation. Cheney-Stokes respiration is an abnormal pattern of breathing characterized by progressive deeper and sometimes faster breathing followed by a gradual decrease that results in a temporary stop in breathing called an apnea. Supination is A. Turn lower arm and hand so palm is down, B. Turn lower arm and hand so palm is up, C. Turn palm towards the inner aspect of forearm, D. Turn fingers position to midline. And the correct answer is B. Turn lower arm and hand so palm is up. Supination is the rotation of the hand or forearm so that the palmar surface is facing upward. Osler nodes and Janeway lesions are manifestations of A. Myocarditis, B. Endocarditis, C. Pericarditis, D. Aortic regurgitation. And the correct answer is B. Endocarditis. Osler's nodes result from the deposition of immune complexes. The resulting inflammatory response leads to swelling, redness and pain that characterize these lesions. The nodes are commonly indicative of subacute bacterial endocarditis, whereas Janeway lesions are irregular, non-tender hemorrhagic macules located on the palms, soles, thenar and hypothenar eminences of the hands and plantar surfaces of the toes. They typically last for days to weeks. They are usually seen with the acute form of bacterial endocarditis. A CT scan of the head shows a collection of blood between the skull and dura mater. Which type of head injury does this finding suggest? A. Subdural hematoma, B. Subarachnoid hemorrhage, C. Epidural hematoma, D. Contusion. And the correct answer is C. Epidural hematoma. An epidural hematoma is a collection of blood that forms between your skull and the dura mater, the outermost protective membrane covering your brain. The cause is usually an artery that gets torn by a skull fracture. Symptoms include severe headache and loss of consciousness. Which one of the following represents the full form of AED? A. Autonomous external defibrillator, B. Automated extracorporeal defibrillator, C. Automated external desynchronizer, D. Automated external defibrillator. And the correct answer is D. Automated external defibrillator. AED stands for Automated External Defibrillator. Which one of the following cardiac rhythm is non-shockable? A. Ventricular fibrillation, B. Pulseless ventricular tachycardia, C. Supraventricular tachycardia, D. Pulseless electrical activity. And the correct answer is D. Pulseless electrical activity. Ventricular fibrillation, pulseless ventricular tachycardia and supraventricular tachycardia are all shockable rhythms, whereas pulseless electrical activity is a non-shockable rhythm. Which of the following sign is positive in deep vein thrombosis? A. Homan's sign, B. Jacquemier's sign, C. Kerning's sign, D. Hager's sign. And the correct answer is A. Homan's sign. Homan's sign is often used in the diagnosis of deep venous thrombosis of the leg. A positive Homan's sign, that is cough pain at dorsiflexion of the foot, is thought to be associated with the presence of thrombosis. Which one of the following vitamins is not fat soluble? A. Vitamin A, B. Vitamin D, C. Vitamin B, D. Vitamin K. And the correct answer is C. Vitamin B. Vitamin A, Vitamin D, Vitamin K are fat soluble, whereas Vitamin B is not fat soluble.